Welcome, everyone. Let's dive right into the details on erythromycin, this macrolide antibiotic that's used for several types of bacterial infections.
I'm excited to get into it. So, what are the main infections it's used to treat?
Well, erythromycin is prescribed for a variety of infections like respiratory tract issues, bronchitis, pneumonia, even Legionnaire's disease, and, conditions like pertussis and diphtheria. It's also used in treating sexually transmitted diseases like syphilis, along with ear, intestinal, urinary tract, skin, and even gynecological infections. It's a broad spectrum approach.
Yep, that's quite the list. And it's also used to prevent recurrent rheumatic fever, right?
Exactly. It is. Now, regarding the dosage forms, erythromycin comes in multiple forms. It's available as capsules, tablets, delayed release options, and even an oral suspension. This means there's a specific form to suit different needs and situations.
So, speaking of the oral suspension, I remember something about needing to shake it well before every use and, using a proper measuring device instead of a household spoon. That seems critical for dosing.
Absolutely. You're right. It's like, you have to get the mix, even distribution, so that every dose is accurate. Using a measuring spoon or dropper that comes with the medicine avoids any unintended dosage errors.
Yeah. And what about how erythromycin works? It stops bacterial growth, if I recall correctly.
Yes, indeed. It interferes with bacterial protein synthesis, which effectively halts their growth. But, it's super important to note that it's designed to tackle bacteria only, not viruses like colds or the flu.
That's a key point. Antibiotics like this shouldn't be misused for viral infections, right?
Exactly. Using antibiotics inappropriately, like for viral infections, can really contribute to antibiotic resistance. Physicians emphasize that misuse can lead to infections later that are much harder to treat.
Right. Now, I noticed there's a special emphasis on precautions before starting erythromycin. Can you expand on that?
Sure. Patients need to let their doctors know about any allergies to erythromycin or other medications, and importantly, if they've ever experienced issues like a prolonged QT interval or low electrolytes like magnesium or potassium. Also, liver conditions, pregnancy, and breastfeeding. All these factors
Yeah.
come into play.
So, no surprises, especially for patients with heart issues. What about the dietary instructions? Are there any modifications there?
Actually, unless a doctor advises otherwise, patients should just continue their normal diet. There aren't any special dietary restrictions imposed by erythromycin itself, which is a relief in many cases.
Understood. Now, what happens if someone forgets a dose? That seems like a common concern.
Good question. If a dose is missed, the patient should take it as soon as they remember. However, if it's almost time for the next dose, it's best to skip the missed one and resume the regular dosing schedule. Doubling up on the dose
Exactly.
is a no-go.
That definitely makes sense. Now, let's talk side effects. What common issues might patients experience?
Most often, patients might notice an upset stomach, diarrhea, vomiting, or loss of appetite. These are the more common ones. But there are also serious side effects to be aware of, like rashes, severe breathing difficulties, yellowing of the skin or eyes, and even heart palpitations or seizure-like symptoms.
Right. Those sound pretty severe. So, if any of these serious reactions occur, immediate action is necessary?
Precisely. If any severe symptoms show up, it's crucial to contact a doctor immediately, or even head to emergency care if needed. There's even a suggestion to report serious side effects via the MedWatch Adverse Event Reporting Program to help the FDA track things.
Now, what about storage and disposal? It's interesting how some medications need special handling.
Definitely. Erythromycin should be stored in its original container, tightly closed, and kept at room temperature away from moisture and excess heat. And like many drugs, it must be kept out of children's reach, which is especially important for households with little ones.
And for disposal, patients are advised not to just toss it down the toilet, but rather use a medicine take-back program, correct?
That's right. The instructions really stress using safe disposal methods to prevent accidental ingestion, especially by pets or children, and to help the environment too. It's all about safety.
Yep. What if someone overdoses on erythromycin? It seems like there are clear emergency actions outlined too.
Indeed, overdose is treated as a serious emergency. In such cases, it's advised to call the Poison Control Helpline, 1-800-222-1222, or immediately dial 911, particularly if the patient is showing signs of seizures, collapse, or severe breathing issues. The website poisonhelp.org also offers guidance.
I see. It seems there's a wealth of detail to ensure safe use. Now I'm curious. How do patients keep track of all this? Sometimes these instructions can be a lot to remember.
Absolutely. It can be overwhelming. That's why doctors often recommend keeping a written list of all medications, prescription, over-the-counter, vitamins, everything, and carrying it around, especially during hospital visits or emergencies.
Right, that makes sense. And, the guidelines also mention that patients should attend all scheduled follow-up appointments. That's to monitor their response, correct?
Exactly. Regular lab tests are crucial to ensure that erythromycin is working effectively without causing adverse effects, particularly if there's an underlying condition affecting the heart or liver.
Yep. Now here's a thought. Don't you think sometimes the instructions, like the dosing schedule every 6, 8, or 12 hours, are a bit too complicated for the average patient? It might make adherence challenging.
I see where you're coming from, but it's actually a necessity to maintain therapeutic levels in the body. Of course, it does demand a bit of diligence from patients, but that's why healthcare providers are really proactive about clarifying these guidelines.
That said, perhaps some patients might benefit from additional support or reminders. I mean, if someone is juggling multiple doses a day, it could be easy to slip up.
That's a valid point. Using tools like medication apps or even simple alarm reminders can really help boost adherence. And doctors can tailor the dosing schedule a bit to fit individual lifestyles, ensuring the treatment remains effective without being too burdensome.
Yeah. Moving on to brand names, I noticed names like erythrocin, pediamycin, and a few others mentioned. It seems like some branded versions may no longer be on the market, right?
Right. There are several brand names, and over time, some have been phased out in favor of generic alternatives, which tend to be more cost-effective while still delivering the same therapeutic benefits.
Overall, it looks like the information around erythromycin is incredibly comprehensive, from usage and dosing to safety, side effects, and disposal. It all ties back to making sure patients have safe and appropriate guidance.
Exactly. The details are meticulous to ensure that not only does the medication work effectively, but patients are safeguarded against potential risks. It's all about empowering patients with the right knowledge to manage their health responsibly.
Exactly. Well, it's been a thorough discussion. The key, as it seems, is clear communication between patients and healthcare providers, ensuring every detail, from dosage to disposal, is understood.
Indeed. It really is a balance of effective treatment and patient safety. And these guidelines help professionals and patients navigate that balance. Thanks for joining in this deep dive into erythromycin.
Yep, thanks for this insightful chat.